to the First Unitarian Church of Salt Lake City, and to those in Zoom universe, we welcome you. This is the fifth of our summer forums, so we are halfway through the year, the season. And before I make some other announcements, Linda Smith has some things to tell us about a food drive we're involved in.
Short announcement. We're partnering with Crossroads Urban Center, a nonprofit that operates a food bank. In the month of July, there is a food bank competition. We need to remember to bring in canned foods, heavy canned foods, and the congregation that collects the most weight in terms of contributions compared to attendance wins a golden can of celery, which we will display if we win it. No, seriously, hunger is a very serious problem over the summers. The kids are not in school, they're not getting their free lunches or their free breakfast, and so the food pantries are particularly stressed. So every Sunday during July, there's 2 more left, please bring in your canned chili, peanut butter. You can bring macaroni and cheese, even though it doesn't weigh very much. There's a bin in the Elliott Hall, and it'll be there every Sunday with a list of the needed foods. Thank you very much.
And I'm going to call your attention to some other opportunities for contemplation and learning and interesting discussions on important topics. Following this session and coffee in Elliott Hall in room 208 upstairs from 11:30 to 12:30 is the Mystical Spirituality Group. Then this evening at 5:30, there's a potluck dinner in Elliott Hall, again right next door, followed by contemplative worship at 6:15. Derek Gersdorf will conduct 2 more adult religious education classes, which are discussions on 2 of the Ware lectures, which are some profound keynote addresses given at the UUA conventions over the years. The first of those will be this Tuesday, again in Elliott Hall at 7. And then Reverend Monica will host 2 more sessions of the Transforming Hearts group. The first of those will be Wednesday. So we got a full week. We can be here every day for the next 4 days if you want to. Wednesday in the Haven, that's upstairs, from 7 to 8. And then another will follow on Zoom. You can get information on all of these additional details on the website or from the Torch newsletter that comes by email. So Unitarian Universalists today see many different meanings in the lighting of a flaming chalice that we do at the beginning of every ceremony. And so I light this chalice today with a few of those meanings in mind. And may the chalice emanate the light of reason, the warmth of our community, and the flame of commitment. Our speaker today is Jen Dailey-Provost. Okay, so the first order of business is to learn how to say her name right. It's not like the university administrative position, provost, but it's pronounced like our quirky neighbor to the south, city in Provo. And Jen was first elected to the House in January of 2019, and she currently serves as the minority whip. And we all know minority means Democrat. Perhaps, hopefully not in permanence, but she's the whip or the vote wrangler in the House, and is a self-proclaimed budget policy wonk. She represents the 22nd District, and if you live in Salt Lake City, north of 5th South, which is the next street up, and as it goes and curves off the hill and becomes 4th South, if you live north of that, and if this side of 300 East, you're in Jen's district. So, by show of hands, if you live there, would you raise your hand? Well, that's pretty good. I don't know if that'll count as a town hall meeting or not, Jen. But maybe I'm sure there's someone on Zoom. Before her election, Jen worked on Capitol Hill as a policy advocate for nearly a decade, health policy advocate for nearly a decade, and moved to the Avenues in 2006. She has a BA from the U in business, an MBA from Westminster, and a PhD in public health from the U, where she's currently teaching and as a public health researcher at the med school. She writes, "My policies, priorities, and passion lie in the areas of public health, primary health care, LGBTQ+ rights and protections, air quality and environmental preservation, education, and restorative justice." She and her husband, Scott, who is an anesthesiologist, you may have seen his face as the last face you saw in a hospital procedure, but they and their 3 kids are avid skiers and runners, and Jen spends any quiet time that she may come across, rarely, knitting and reading a good book. So please welcome Jen Dailey-Provost. Very good, thank you.
Thank you, Jim, for that warm welcome, and thank you all, everybody, for welcoming me into your community today and inviting me to be here. It's lovely to see some familiar faces and to meet new friends today. As mentioned, I'm Jen Dailey-Provost, and oftentimes when I introduce myself, people think that I'm saying my name is Jen Dailey from Provo, so I always welcome the opportunity to clarify that I live in Salt Lake City. We love Salt Lake City, and it is one of the great privileges of my life to represent our downtown community in the Utah House of Representatives. It's not the best because I am a mom. I have 3 amazing children, ages 18, 16, and 6, so we are often going in many directions. But everything that I do in public health, in the legislature, in my policy advocacy, in my volunteer service in our community, centers around making the world a better place for my kids to inherit. And I think that, when we're grappling with a lot of the issues of the day, many of which I'll cover in the next 45 to 60 minutes that we have together, always center around that for me. And it's not just my children, it's their peers, but the world that we're leaving behind them. And I would be stunned if there were many people in this room that didn't feel similarly. So thank you again. This feels like a very welcoming, open community, and I'm excited to share my experiences and thoughts with you. So, down button, right? Yep. All right. So we're here to talk about policy and community. Primarily for me, that centers around health. And it is one of the main reasons that I ran for public office, and one of the main drivers for me to get involved in public service was actually Medicaid expansion many years ago. I'm sure you all remember many years of fighting the legislature to please pass something, anything, to expand Medicaid to uninsured and our most vulnerable communities in the state. And so I have been at the Capitol having that battle for a long time, among many others. So quickly, and Jim covered this in the introduction, but I wanted to just give a brief overview of why I'm here, why I am passionate about the work that I do. As mentioned, House District 22. I will make one correction. It goes to 3rd West, not 3rd East, so there's an extra 6 blocks. When they redistricted, yeah, exactly, right, yes. I tell people all the time that I represent the very best district in the state, so if you don't live in my district, I'm sorry, you can always move. But when we redistricted, my whole district moved a little bit east, just as kind of a whole shift. And now that the district is 3rd West, West High is now out of my district, which breaks my heart because I have a junior in high school at West High, but I do represent the tennis courts and the track. So we're good, a little bit. If you ever hear me halfway joke about rebuilding the school across the street, it's only a halfway joke. I kind of want it to move over to the east side of 3rd West. But what's significant for me when we're talking about building community and keeping communities that live and work and play together, it makes me really sad that I don't have a high school in my district anymore, which tells me, number one, changes the demographics of my district a little bit, but also that we're seeing continued political divides and divides in access and and equity that is disturbing. And so it might see, I can make jokes about representing the track and the tennis courts, but our communities are becoming more inequitable, and this plays out for our high school and middle school kids most acutely. And so it's just something to keep in mind when we're talking about district demographics. So I started my service in January 19. I ran for office. I won my first election in November of 2018. It was if you'll remember, we were halfway through a certain past president's term, 4-year term, and things were feeling pretty dire and stressful. My representative was Rebecca Chavez-Hauk, one of my heroes in the world and a mentor of mine, and she had decided after 10 years of service that she was going to retire. And so she and I had a lot of really hard conversations about what it would mean if I decided to run to fill her shoes. Now, she has very big shoes to fill, and I still strive to get there. But I had, when she and I had this conversation, I had a not quite 1-year-old at the time. And ultimately, the reason I decided to run was I had a conversation with Rebecca, and I said, I've watched you do amazing things as a female, as a Democrat, as a Latina in the Utah legislature. There are a lot of great ways to make a difference in the world. This could be a cool one for me to take advantage of also, but I'm not going to run if you're not going to vote for me. So, the reality was a lot of people ran for office, and if there was another candidate that she felt was better suited to the job, I would have stepped aside and said, I'll support this person. Lucky for me, maybe some days not so lucky, I had her support. And to this day, I still reach out to Rebecca for guidance and thoughts, and that is the beauty of being a public servant, is I am an expert in this many things. You are experts in all the things. And so being able to draw on community expertise, community experiences is, in my belief, the best way to engage with our community and to craft better public policy. As was mentioned in the introduction, I had worked for a decade prior to running for public office in public health and healthcare policy advocacy. That manifested in working on Medicaid expansion, many tobacco issues with regard to tobacco companies targeting our youth, homelessness services for people with disabilities. I've worked really closely on the social services appropriations budget for many, many years. And I will touch on this a little bit in a few minutes as well. But the budgeting process, if you want to get really, really wise about affecting policy outcomes, you talk about the money. And we'll talk about that some more in just a little bit. I do live in the Avenues. We love raising our children there. As I mentioned, my husband and 3 kids and I live there, along with our dog, our cat, our 2 chinchillas, and our number of fish. We love to hike, ski, travel, walk around our neighborhood. I personally love to knit when I have time, run, and to read a good book that is not necessarily a bill. What does all this mean? It means that we're a citizen legislature. No, there are no elected officials in our legislature who are professional politicians. We all have other jobs or did have other jobs. The job, unfortunately, is probably best suited to people who are retired because it is such a big time commitment. And that is important. And but it's, I could argue the pros and cons for a citizen legislature versus a professional legislature, and there are good reasons to have both. I like our citizen legislature because we do bring a variety of experiences and professions to the table. I will say that it brings a lot of real estate developers to the table, brings a lot of attorneys to the table, brings a handful of medical professionals, but it brings just one public health official, and that's me, which I find devastating. So every time I talk to anybody who works in public health, I encourage as many as I can to someday, if not today, consider running for office, because we need more public health people at the table. We need more teachers at the table. The job while in spirit is a citizen legislature, the time commitment and the pay precludes a lot of people from ever even having an opportunity to run for office. And I do think that that's a problem that we need to continue to talk about. It's really hard as a public official to say we need to pay legislators more. And it's not because I personally need to make more, but we do need to make it financially sustainable for people who can't necessarily take 6 or 8 weeks off every winter to be full-time at the Capitol during session, and then several full days during the month while we have interim session. So I'm very, very privileged and fortunate to be in a situation where I can do the work that I do and balance that with my work as a legislator. Hi, Liz. One of my amazing former colleagues and good friend. And also, as mentioned, I am a public health researcher, PhD candidate. I defend my dissertation in 3 months, and I teach 2 graduate courses at the University of Utah. And here's my contact info. Don't panic; it will be up at the end of the screen, at the end of the slideshow as well. So you are welcome to take a snap of that or get the information if you would like to contact me. Best place to reach me is to text me at that cell phone number. Email is a little bit harder because we get a lot of spam these days. The rhetoric has increased dramatically, and it's been really hard to sift through the noise. There's been a lot of email blasts that are that tend to create a lot of noise. Anyway, we'll leave it at that. So, public health. Typically, I don't like it when people read slides to me, but I'm going to read this out loud just for anybody if they're listening and not able to read. Public health is the science and art of preventing disease, prolonging life, and promoting health through organized efforts and informed choices of society, organizations, public and private communities, and individuals. The 3 P's of public health: preventing disease, promoting health, prolonging life. And my favorite, the World Health Organization defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So y'all thought I was here to talk about politics, and here I go on and on about public health, right? So what's the deal with that? All policy is public health. I will say this till I draw my last breath. There is nothing that we do at the legislature, at the county council, at the city council, Congress, international law. Everything we do affects the health and well-being of people somewhere. Revenue tax, transportation, natural resources and the environment, health and human services, a committee that I sit on. And so one of the things that I feel is my responsibility as the only public health official in the Utah legislature is to constantly push my colleagues to understand that at the end of the day, the decisions they're making will affect the health of the people that they represent, all the people that live in this state. And my goal, ultimately, whether I achieve it or not, is to continue to try to recenter the mindset of the policy decisions that we make, and not just as legislators, but the policies that you support as community members, whether it's with your state legislator or with your council person or with staff at any of the jurisdictions that control the policies that affect the communities that we live in. So I'm sure you all know and are tired of talking about the pandemic. We are in the midst of an epidemic, and it's not just COVID. We've got the opioid crisis, bad air quality, discrimination, climate change, homelessness, intimate partner violence, sexual violence, substance use, drought, structural inequities, racism, water pollution, climate refugees, the immigration crisis, chronic disease, healthcare access, mental health. It's breathtaking. These are all epidemics that we have been grappling with long before the COVID-19 pandemic. What COVID-19 did was it gave policymakers an opportunity, whether they wanted to or not, to shine a bright light on the fact that all of these existed, made COVID worse, and COVID now in turn has exacerbated all of these problems. And not just because we're paying closer attention to them. They're getting worse. Hopefully, we're going to continue to pay attention to them. I certainly will keep pushing these in my conversations and in the policies that I run. The bills that I run up at the legislature. But again, centering public health. Now, public health got a really bad rap during the pandemic. It seems, I think I used to tell my colleagues and students that I spoke to in the public health realm before the pandemic that that public health was doing its job reasonably well when nobody knew what public health was. And, when things go wrong, then everybody knows what public health, they know the words public health, nobody really knows what it is. One of my great frustrations early in the pandemic was every time an issue came up with COVID, the default was to lean on the medical professionals that work in the legislature, not recognizing that medicine and public health are very, very different, tied to each other. But the great thing about public health is that you have an entire profession of people whose sole purpose in their careers is to make people healthy or to facilitate an environment or a situation where people can have some opportunity to live their best life, to thrive in the best way that's meaningful for them as individuals. And so that's the goal and the role of public health. Lately, because of the pandemic, because everybody needed a fall guy and the rhetoric and the emotions were just so strident, public health has emerged from it with a rather bad rap, and that's unfortunate because it makes it harder for public health professionals to do their jobs. Makes it harder for me, who wants to push good policy related to public health, to convince my colleagues that we have to double down on promoting the health of the public. And that's not to say there weren't missteps made. I'm not here to say that every public health professional, every decision was ideal and that everything went well. But do know to a person, public health professionals' goal was to save lives and preserve health to the greatest extent possible. And we are never going to get our head around or get our arms around any of these epidemics if we don't, as policymakers, do a better job by centering the issues of public health in decision making and policies. Oh, and deforestation and reproductive health. I couldn't remember how many clicks it was, and I was afraid I was going to advance the slide too many. Too many clicks for if I'm sure you will probably agree if we're talking about epidemics, and that, of course, isn't all of them. So, as a legislator, I'm sure you can imagine that I'm here to tell you that to make a difference, you must get involved in the legislature and you must get involved in policy, right? Because that's the only way to make a difference, right? No, of course that's not. I was raised with the firm belief that regardless of what I wanted to do when I grow up, one of the things that I had to do was try to make a difference in the world. And I'm grateful that my parents raised me with that mindset. I am hopeful that I am raising my kids with the same mindset. So far, I think I'm doing okay, but we'll see. Running for office at whatever jurisdiction is a very, very cool, interesting way to make a difference in the world. There's no question about it. It is a privilege to do this work. It's hard work, but to do good, you have to be willing to do the hard work. There are so many great ways to make a difference in the world. You all being here helps. Your food drive is going to make a difference in people's health and well-being. In this capacity, though, this is the way that I'm trying to make a difference now, and that manifests in my standing committees. I serve on government operations at the legislature, which is basically elections policy, and I also serve on Health and Human Services. For interim committees, I sit on Health and Human Services as well, and Revenue and Taxation, which I'm absolutely convinced the Speaker put me on because he doesn't like me. No, I'm kidding. He actually likes me, and I have found Rev and Tax to be far more interesting than I expected it to be, and I'm learning a lot. So, when somebody puts you in a situation where you're not in your comfort zone, I say, bring it on. I'm just going to get really good at this, so you put me on something else, and I'll get really good at that too. Appropriations committees. I serve on social services appropriations, and I did mention this earlier. This was a budget that I worked on as a policy advocate for many years prior to running for office. Social services is the largest subcommittee budget in the state. It's close to $10 billion now of our $28 billion budget. Unless you combine higher ed and public ed, and if you combine those, then technically education's bigger, but you shouldn't combine public ed and higher ed, and so social services is appropriately huge. Social services funds the Department of Health and Human Services, the Department of Workforce Services, and also I would note that it is the budget that receives the largest amount of federal funding. I also sit on executive appropriations. As the minority whip, I serve in leadership in the Democratic caucus at the Utah House, and so I have a vote on executive appropriations, which is not a subcommittee budget committee, it is the budget committee. And so I work really closely. I spearhead the budget issues for our caucus, and so I work in our leadership team most closely with the chairs of the Executive Appropriations Committee because I am a budget wonk and I love working on the budget. Because that is, at the end of the day, doesn't matter how many bills we pass, that's where the rubber hits the road, is where we, when you put your money where your mouth is, this is where it really comes down to whether the legislature has power to make a difference. Now, again, coming back, it's not just about the legislature, it's not about laws, it's not about the state budget. This is the legislature's role is to fund the services and the activities of the state government. It's one way that we need to do more to address the many needs of our epidemics in our state, in our communities. I also serve on a variety of other committees that I'm not going to go into, but I'd be happy to on a personal level if you really want to hear about administrative rules and government oversight, or you really want to hear about Legislative Management Committee or Capital Preservation Board. But of course, the whole point is to make a difference, one can do these things. And this is one way that I have the privilege to do it. As I've indicated, I don't even attempt to, even if somebody wanted me to, separate my legislative hat and my public health hat, because that would be foolish, because we all need to center public health in our work. So how does your expertise as community members inform good policy? And this is the rub, right? Where do we find good data? How do we know it's good data? Where does it come from? How do we know it creates good outcomes? Unfortunately, when it comes to our citizen legislature, we don't. Too often, unfortunately, policies are made because a handful of people had a certain experience in a certain area of their lives, and they got the ear of their legislator, and we make really big decisions that affect the entire state of Utah based on anecdotal data that happens to a few people. And this has gotten more strident in the last 6 to 7 years. I could stand up here and blame it on a certain past president. That wasn't all of it, but it certainly affected the tenor and the way that we have conversations at the public policy level over the last few years. And it's not, it's being an elected official is never an easy job. It's especially not easy now because the tone and the divisiveness and the meanness in the public discourse has gotten really hard. And this is not me standing up here saying, please feel sorry for me, please be nice to me. I'm not asking for that. You don't run for office hoping that people will be nice to you. I do run for office hoping that you will bring your expertise to me, teach me, help me understand, and help me frame it in a public health framework so that we can ultimately make decisions that do help communities. I run a lot of legislation that addresses the needs of our disability community. because I got to the legislature and I realized that we pass a lot of bills to help real estate developers, and we pass a lot of bills to help bankers, and we pass a lot of bills to cut taxes. But we continue to leave our vulnerable communities farther and farther behind in the state of Utah. And the way that I was able to thread the needle to find policies that really helped our disability community was I had conversations with people in our disability community, with advocates that I've worked closely with for a number of years. And so, it starts with having an honest conversation, being able to recognize that policy is a baby step process, that we do have to pass policies that inch toward better, and also be willing to step back and say, you know what, that didn't work. We need to do so, to admit that you maybe didn't make the best decision at one point, and that you're willing to admit mistakes, learn, pivot, do something different. And so to make a difference, you don't have to engage in the political process, but you can. And it's a really effective, powerful way if you can have those honest conversations and find legislators who are willing learners. And I wish I could say that every legislator was a willing learner. They're not, but we'll keep trying. All right, so most importantly, if you want to know somebody's values, look where they spend their money. This is a really big deal to me, and I keep harping on social services appropriations. The last 2 years, I have seen a really dramatic shift. It used to be that the social services subcommittee we'd work really, really hard. We meet twice as much as all the rest of the committees. We meet every day during the first 2 weeks of session. The rest of the appropriations subcommittees meet every other day because it's such a complex budget. And we spend hours and hours and hours during the interim looking at our budget. Used to be, prior to 2 years ago, the executive appropriations was pretty deferential to the subcommittees on what they put forward. But the last 2 years, EAC has received the budgets from the subcommittees and kind of done their own thing. And there has been a dramatic decrease of the relative proportion that social services is to the total budget over the last couple of years. And that's the exact wrong direction that we need to go to. In 2008, when we went through the Great Recession, we had a 30% contraction in the budget. Social services that year cut 30% of its budget that funded the most vulnerable people in the state. You know what got funded fully in 2008? Highway construction. And so, unfortunately, even since 2008, as we've tried to claw back and get back to baseline pre-2008 for these services for our most vulnerable, we're still not even there. And we were headed in that direction, but the last 2 years we've seen a contraction. And I am really, really sorry to say that straight from the horse's mouth, when I said, why is there a diminishing relative proportion of social services of the total budget? The answer was, we've just spent so much on that committee for so long, it has to stop somewhere. Thank you. I know, and it's hard for me because I mean, if I was the queen of the legislature and I got to wave my wand and create a budget, Liz, I'm sorry, I know you sat on Beetle, but Beetle would be gone. Beetle is business, economic development, and labor, and we do a lot of granting money to private theaters in Utah County and helping people pave. Yes, I know. Thank you. And it's frustrating because at the end of the day, is that where we should be putting taxpayer money? I don't think so. And so this is, again, I'm trying to constantly center these conversations around public health. Now, we have made some strides. We did invest a lot of money into saving the Great Salt Lake, which was way past critical mass. We have done an okay job funding more for wraparound services for our homeless communities and for building affordable and deeply affordable units, but that takes so much time to get those online. And my concern, of course, is that we spend a couple of years dumping a few pots of money here and there, but then what we can't do is let the legislature say, I've checked that box, moving on, I don't need to do this anymore. And so it has to be this constant conversation. It has to be an investment, a permanent investment. I don't think that the mindset of the legislature, that we're there yet. So we have some work to do. So, Tim, you don't get to answer this question. Or Liz, what is the one statutory role of the Utah legislature? What's the one thing that we legally have to do?
On the budget.
Budget. Yeah. Exactly. Thank you. We don't have to pass a bill. We could not pass a single bill. And honestly, you could argue that we'd probably doing a better job if we just didn't pass any bills. Except mine, of course. We have to pass a budget. Oops. We have one constitutional duty. So we could come into the legislature on day one, pass a budget, go home, and we will have fulfilled our constitutional duty. And like I said before, all the rest of the stuff we do, and we do a lot. We numbered over 800 bills last year, passed close to 600. I think we set a record number of bills that we passed. I bet you know the number, don't you? Yeah. 1,300 bill files opened last year. I think we're probably a little too overzealous in the amount of work that we're doing, because bills are passing with very little scrutiny. And I don't know yet the best answer to doing that. I think if you're looking at legislators self-regulating themselves, it's going to be a problem. But I also think that it's not necessarily the right solution to say you only get to pass 5 bills or you only get to work on 5 things. So I don't know. That's a debate that we continue to have. Like with the citizen versus a professional legislature, I could probably argue both extensively. I am a politician after all. I can talk for a long time. But at the end of the day, I'm hopeful that with more community involvement and less rhetoric and less strident, awful messaging that we're seeing more and more of, that we can continue to have really good discussions with our legislators, one-on-one, talking to both your personal elected officials and others who work in areas that you care about. Because, in a perfect world, as legislators, we all have in our phones, and I do. I have subject matter experts that I keep in my phone, and I put little cues in my phone. So when I type in education, everybody in my phone who's an expert in education pops up on my screen, and I can text or call those people to ask about how a policy is going to affect their communities. Sometimes it works. Sometimes things move a little too fast. But shy of that, I'm not sure the best way for legislators to be proactively engaged and informed by their community members. And so to the extent that you can be a subject matter expert for your legislator or all legislators on what you are really good at and what you're really knowledgeable at, it can't hurt. And it certainly has a lot of room to make a difference. Okay, so next slide. I just want to go over this briefly because this comes up a lot. And since I'm in a church, I really, really like to talk about the issue of church, the separation of church and state, because we live in a state that has this big church that seems to be pervasive in a lot of areas in our communities. I'll let you guess which one. As you can imagine, I get contacted by a lot of lobbyists on a regular basis, and I hear from the lobbyists from the LDS Church a lot. They are very active, and what I hear from a lot of people is that this is not appropriate, that this is a clear violation of the separation of church and state, and that somebody has to do something about the role of the LDS Church in our state. I would purport the LDS Church has an outsized influence in our state, in policy. I will never say that the church should not have a role in policy in the state of Utah, any more than I would argue that all of you, on behalf of your congregation, should not have a role in policy discussions in the state of Utah. I think that it is dangerous to say because one entity has an outsized role that no one should have a role. And I want to, and this is a hard conversation to have because I am not one to say, I am not LDS. And I am often frustrated by policies being passed with what I perceive to be less than robust scrutiny from some of my colleagues. But I also believe that a legislator's desire to be, for his or her policy decisions to be formulated through their faith is as important as my desire to be formulated through my humanistic tendencies or a lack of religion. And so I wanted to bring this up because this does come up and it seemed really appropriate because I hope that on behalf of your congregation, on behalf of your families or yourselves personally, that you feel perfectly comfortable going to the legislature and say, my religious beliefs are this, my church teaches me this, therefore it is important to me that XYZ happen. I don't think that we want to preclude the ability to do that because the reality of one church having a very outsized influence and policy in the state. The Catholic Church has a large amount of influence on policy in our state. I personally have worked with the lobbyists from the Catholic Church on a lot of really good policies because some of the things they work on are, I believe, are very central to better public health. Not all of them, but some of them. So with that said, challenges in the state of Utah. We just touched on outsized influence. I know it's easy to assume that I stand up here as a Democrat in Utah, that it's just not fair that we have a super minority and that we don't have the ability to create any kind of significant procedural roadblocks to policy. And to be sure, it is very, very frustrating. But it is a problem, whether it's Democrats or Republicans, that there are supermajorities in any state because it precludes a lot of it precludes a lot of the opportunity to compromise and come to policy decisions that are give and take. And the only way that you can do that is if you don't have a supermajority. A lot of that, of course, is a lot of it has to do with decades of gerrymandering, and not just in Utah, but in a lot of states around the country. And I wish I could say that it's not as bad as it seems, but the gerrymandering in Utah is as bad as it seems. There has been a very concerted effort over 50 years to peel away the ability for minorities to have a say or a procedural influence in legislatures, and Utah is not immune to that. My greatest frustration in policy in the state of Utah is this hyper-focus on the economy. You hear especially leaders in our legislature talk a lot about how Utah is the best at everything, this exceptionalism in Utah. U.S. News and World Report says we're the best economy, the best place to start a business. I would purport that those are good things. It's great to have a good economy. It's great to live in a state that's good for supporting businesses. But when we have people in Utah who say that Utah is the best because of this, every measurement that they list is a measurement of how well the wealthy are doing. Utah is the worst state in the world for gender equality. Not in the world, in the nation. I would say probably there are places in the world that are worse for gender equality even than Utah. Sorry, I misspoke. We are the worst in the nation for young children of color having health insurance. So I would say that depending on what metrics you choose, and again, it comes down to the data, depending on how you measure it, Utah's got some work to do. DSPD wait list. This is a passion of mine. It's the Division for Services for People with Disabilities. We have funding that supports families who have children with complex permanent disabilities to help them provide the services that they need. Right now, it's 20 years long. If you have a child today with a significant disability and you put your family on that list, statistically that child will be 20 years old before you get any kind of help from the state. We are either not funding it, or we're funding it at such a small amount that we're not even funding the growth in the state. And we are the fastest growing state in the country. This is a travesty. This is horrible. And I keep talking about this, and it just isn't getting fixed. So again, depending on how you look at it, Utah's a great, it is a great place to live, right? Like, I chose to live here. This is where I wanted to raise my family. I do love Utah. There's a lot that I love about this state. There's a lot that makes me really, really angry, and I hope that it makes you angry too, because this is not tenable. It's not sustainable. And this hyper-focus on market forces, oof. As Jim mentioned, I have 2 business degrees. I can talk my way around Adam Smith day and night. Now, fact, Adam Smith did not trust business. So Milton Friedman's whole, like, the market will fix everything. Adam Smith was right. The businesses are good. Adam Smith did not trust businesses. His thing was, we need somebody he was very distrustful of industry, of any profit-making industry, because at the end of the day, he believed, and I think he was right, that if it comes to making money or helping people, businesses are not going to help people. Businesses are going to make money. And so his whole idea has been perverted. Milton Friedman, I blame completely, which I can do because he's dead. This idea that markets would correct everything, that we can solve healthcare through market forces, that we can deal with education through market forces, is just a fallacy. And this is my greatest frustration, that we can solve the social ills of our communities through traditional market forces. It hasn't worked. It's not going to work. When you put profit between services and people who need the services, you're only going to help the people making profit. Has to do with healthcare. We talked about this earlier. And so we have to find a way to stop focusing on market forces as the only solution to the ills that we struggle with. We have to stop talking about running all of our social programs as a business, because they're just not. Education is not a business. Healthcare is not a business. I work at a school of medicine. It's not. And so these are some of the conversations that we need to recenter. Oh my gosh, I'm way out of past time. I'm sorry. And then, of course, I've touched on it several times, a dramatic increase in the hyperpartisanship and rhetoric. Okay. What do we have to do? We have to keep talking about the hard things. I'm going to go through these really quickly because I just realized I've been rambling for longer than I intended, and I apologize. Representing the district that I do in downtown Salt Lake City, it's a very, very blue district, and I have always interpreted that as not only the opportunity, but an obligation to run policies that push the envelope a little bit. This is a really good example. So a couple of sessions, and I'm not done with it, I have run bills that create a legal framework for not the state, but some entity, a nonprofit entity, to come up and basically create heroin injection sites. I know this, it makes people really uncomfortable and it seems counterproductive, but this is a known fact. It saves lives, and we can't save people's lives who suffer from addiction if they're dead. And so giving them a safe place to engage with the system, a place that doesn't vilify them for having a substance use disorder, that almost completely eliminates the possibility for death by overdose, creates a cleaner environment, reduces HIV transmission, reduces hepatitis transmission, etc. I'm a big, big fan of harm reduction, and this is an area that most of my colleagues just don't even want to talk about. So we have to keep talking about the hard things, reproductive rights. I could talk for an hour just about that. Criminal justice reform. Incarcerating people does not make our community safer. And it certainly doesn't help our economy or any of the people who exist in it to punish them for the rest of their lives. So when people go through the criminal justice system, when they come out, we have a tendency to punish them forever. They can't get good housing. They can't get good jobs. We have people coming out of incarceration that are required by their parole to find a place to live. So they find the worst place that will they find the only place that will take them. They're not good living situations, and then their families and their kids move into them. Re-entrenches intergenerational poverty and puts those kids at increased risk. So we have to keep talking about criminal justice reform. We got to keep looking at voter rights and protections that thread the needle between making sure we can ensure confidence in the system without disenfranchising our most vulnerable, which of course in the modern era, people of color, immigrants, people with a criminal background, non-native English speakers, et cetera, these communities are being disenfranchised from our elections. Racism is, aside from the recent COVID or the current COVID pandemic, I think is the biggest pandemic that we're struggling with right now. And tangential to that, of course, discrimination, supporting our most vulnerable communities. We are, I know, not doing enough to help our homeless and our unsheltered population. To a person who works on this, we are trying really hard. There are no hard, fast solutions. There are some good things that are happening. We're looking at other cities, we're looking at other states where people are finding individualized paths. We haven't solved it, but there are people coming out of homelessness. There are people that will always need supports for the rest of their lives. I do believe, I will unshakably, we have to do this. We have to be able to provide housing and wraparound services that are individualized, that help people where they are to stay housed and stay healthy in what that means for them. Because thriving is different for every single one of us, right? What it means for my family to thrive is different than everybody else, and that's okay. But that comes down to public health. That comes down to creating an infrastructure that helps people thrive in a way that's meaningful for them. And then this is my last thing I'm going to talk about because I got a specific request to talk about medical aid in dying. So I have run legislation. Representative Rebecca Chavez-Houck before me ran this legislation as well, to create a legal framework like they have in Oregon and some other states to allow patients who are terminally ill to receive medication with a lot of guardrails. I mean, there are a lot of hoops to jump through. We have vetted and talked about this. The fact of the matter is there was a study done, a survey, that 62% of Utahns support medical aid in dying. And yet only once in the 4 times I've run this bill has it gotten to a committee, and I only got 2 yes votes, and I was one of them. The sentiment among legislators is not reflective of the community at large on this issue. I think one of the biggest parts that play into that is that people support it, but they don't feel comfortable reaching out to their legislators about it. And so legislators are just not hearing from their constituents how important this issue is. I kind of think that the only way that we're going to get this done is ballot initiative, which of course in the state of Utah is fraught with a lot of stress because we've seen the legislature's complete lack of compunction in completely reversing or gutting every ballot initiative that we've passed. So I would propose, in a perfect world, and when I win the lottery, I'm all over this. When I drive to Idaho and win the lottery, we have to have a ballot initiative. So we've got to, as a citizen populace, we need to pass a bill that changes how ballot initiatives go into effect. That basically creates some barriers for the legislature to come in and gut anything that's passed by ballot initiative within reason. I could opine for a long time about why it is important that the legislature should be able to come in and change some things within reason, but I do believe that there's a way to accomplish that. So with that, I apologize for going so long. Thank you for having me. Again, Here is my contact information. Text is best. When you do text me, please be sure to include your name in the text so I can save you in my contacts. Tell me what you're most passionate about so I can add you to my phone as my subject matter experts. And with that, I'm happy to take questions and extend the conversation.
Good morning, and thank you for your enlightened presentation and your enlightened work. Two quick comments, one question. I was curious, last night on PBS Utah, we saw a documentary about the bubonic plague in San Francisco in 1900 and how business, the press, and the government wanted to suppress it so that business could continue. It's a great documentary, and we're making the same mistakes now. So, number two, what was that? Anyhow, number three, politics. Come back.
I do it all the time.
Politics affects everything we do, all the work you're doing. Several of us went up to the Supreme Court's hearing on better boundaries. What is your take on that? Is there any hope whatsoever?
Yes, there is hope. I actually do have a lot of faith in our judges. You know, on one of my slides I had mentioned the supermajority in the executive and legislative branches. And I specifically didn't include the judicial branch in that because it's not supposed to be a partisan branch of government. But, I mean, every justice has been appointed by a Republican, a governor of the supermajority party. I have seen decisions from members who currently sit on the Supreme Court, specifically Chief Justice Durant, that are, I believe, very reasonable and well thought out, and that are not based on partisanship, the partisanship that one might expect of a bench that was wholly placed by a supermajority political party. I was in meetings during it, and so I've gone back and listened to some of the arguments, and I believe that the case was exceptionally well argued by the plaintiffs. And I think that by judging by the questions that the justices asked, I'm not convinced that they're not convinced that the defense has a good argument on it, because the defense basically, they're basing it on this idea that only the state legislature has the power. And it didn't sound to me like the justices were necessarily convinced that was a very good argument. But I'm an optimist to my core, and so I'm not going to lose hope until I have to. It has been really interesting as a legislator, because the case ultimately is defended by the Office of Legislative Research and General Counsel. They are my attorneys as a legislator, and for that reason, they actually hired a private law firm to defend the case because of what I believe is a conflict of interest. Because if they're defending a case that I, as a legislator, and support the plaintiffs on, but many of my colleagues support the defense, it's really hard to kind of put them in that position. But they have actually been working to defend the case, and I'm hoping there are times I want to text and be like, do your worst job today. But yeah, I am optimistic. So that was a long answer. I apologize. Fingers crossed. Yeah. On subsequent to, if they do find in favor of the plaintiffs, my question then is, what then? Because we've already got sitting congressmen representing boundaries that arguably should be undone. So it's going to be interesting to see how it plays out. Sorry.
Thanks so much. Guns have now become considered part of public health.
Yes.
And public health can address gun violence. What possibilities for addressing gun violence do you see with this legislature? And I'd like you particularly to think about guns and youth.
I understand that we're the only country in which guns are the primary cause of death for children and teens. Thanks.
Thank you. And I would like to rewind time and go back and add to my slide, my epidemic slide, gun violence. Thank you. This one's hard. I have open bill files trying to address gun violence that never got past rules. Many of my colleagues have open bills to try to address gun violence that even if they got past rules and into committee have died. That optimist in me is a lot less optimistic when it comes to violence. This is a public health crisis. It has been a public health crisis for a long time, and I am stunned and appalled that we can somehow pass a bill that protects kids from Instagram, but not semi-automatic rifles. And I mean, it's funny and hilarious in a devastating, heartbreaking way, right? And I really, really wish that I had a better answer for you on this. We live in a state, like with medical aid and dying, that I think people are just nervous about reaching out to their legislators, or they're ignored when they reach out to the legislators and say, we can do better on this without taking away people's rights to guns. And I mean, I could also opine for a long time on how much I think the Second Amendment actually protects the ability to own a gun. The only place that I've seen a lot of progress that I think until we can change mindsets, and I really do believe that, kids my age, my 18, 16-year-olds are Gen Z that are coming up. I really do think policy will change when they start coming of age and taking more direct role in policy, because it's a generation that I think is just fed up with gun violence. Sadly, thousands of, not tens of thousands of people will die before we get there. The one thing that we have been able to make some progress on is providing gun locks and support services to keep the guns that are out there safer. But it's not going to be enough until we just get a mindset change among lawmakers who are there. Keep talking, keep encouraging people to reach out to their legislators, even if they know they're not necessarily going to be heard. I'm sorry.
Thank you for being here. We are new to the state of Utah. Only lived here a couple of months, and so I have a very simple question.
Yes.
What % of the legislature represents the LDS community versus the other communities out there?
It's a great question.
It wasn't meant to be a funny question.
Yeah, no, it is a great question because, the Salt Lake Tribune calls me at the beginning of every 2-year cycle to ask my religion, and they do that with all legislators. And it's so I believe in Salt Lake County, it's probably a little over half, but the state is 83 to 84% LDS, but the legislature is like 92. Yeah, so even among even among Democratic colleagues, many elected officials are LDS. So it's dramatic, and it has a lot to do with the fact that culturally the LDS Church is really effective about nurturing its leaders and pushing them to aspire to leadership positions.
We have one from Zoom.
Yeah, we've got a question from Kathy on Zoom. She says, Jen, I appreciate your support for end-of-life choices. What can we do to move toward more options, including medical aid in dying? Is there a committee for people who want to raise awareness of medical aid in dying? I'm a Unitarian Universalist with a vacation home in Utah, and I know many people interested in this.
Thank you, Kathy. That's a great question. So I have, through my 5 years so far of serving in the legislature, kept a roster of people, of everybody who has reached out to me on this issue. And recently I'm hearing more about this. It has kind of waxed and waned. Early on in my legislative career, people were really involved in reaching out to me about it, and then it kind of falls off. Probably has a lot to do with the COVID pandemic. But there is renewed vigor and interest around this, and so I do have now an email list that's probably got 40 people on it, and a small group who live in my district who are really interested in bringing the community together and spearheading this conversation. For me personally, again, we're a citizen legislature, and I want to reiterate that because my bandwidth is, I try to expand my bandwidth as much as possible, but to the greatest extent that community members can come and spearhead these conversations and coordination, that helps me a lot so that I can be part of the conversation, but not necessarily responsible for leading all the conversation, because policy is just one piece of a conversation, right? It's not just passing a law. It's getting out to communities and doing community events and reaching out to people outside of Salt Lake County to reach out to their legislators and getting legislators on board who aren't, myself and my 13 Democratic colleagues on the House floor. So again, email, text message. If you're interested in being on that email list, please text me or email me and specifically say that. I'll add you to the list. And then when we start to get really organized and having some meetings about this, then you'll be able to be pulled into that conversation, but I am actively working on it. So thanks, Kathy.
Hi, I'm Kurt. You won't believe where I'm from, Sacramento.
Welcome.
And our situation is the opposite. And I applaud your fight because it makes a difference to live in a place that is where you feel freer and less controlled by the legislature.
Thank you. And I'll just comment that California does have a professional legislature, so they don't have a citizen legislature. It does. Yep. Every place has got its goofiness, certainly.
Jen, thank you for speaking. I have a comment and a question. Comment is with regard to the Utah State Supreme Court. Mm-hmm. If the justices rule in favor of the plaintiffs, given the clock is ticking, that the Lieutenant Governor, serving as state elections officer, has indicated that by November, that decision has to be made with regard to redrawing maps in time for the congressional races starting next year. The maps are there. The legislature can choose one of the three nonpartisan, apolitical, objective maps that were drawn by the independent 7-person commission. They're there and ready. The legislature ignored it, tried to erase it. It's there, and given the fact that the clock is ticking, one of those maps could be quickly implemented in time for candidates for 2024.
Thank you, Tim.
Okay. Question is, do you need more time to do your job? You've indicated that there's a need here. There were about 1,350 bills that were given a number, or almost 600 that were passed through over a period of 45 working days, really 33 working days when you discount holidays. Mm-hmm. 50 years ago, the legislature realized they had a problem, and they went from 80 days over to 90 days over a 2-year period. And what we see here is quick and dirty efforts, superficial efforts, bills being passed with almost no attention given, special projects given to bankers and real estate people instead of meeting the special needs of the state. Do you need more time, given it's a citizen legislature, to do your job?
So, yes, we either need to run fewer bills and pay more attention to them, or we need a longer session to give better time and scrutiny to the bills that we do run. My concern is that it's never going to be that simple. If we give ourselves more days during the legislature, we're just going to pass more bills, right? I think it's not about people saying we need more time to deliberate. I think that we would just fill it with more stuff because we've reached this mindset that we can just pass bills without much scrutiny because there are no repercussions to it, right? Nobody from the community is saying, well, with some exceptions, and the really good one was the Cougars, right? We passed this bill that got changed in the Senate, came back over to the House, and without anybody realizing that it happened, with no statement whatsoever, we unwittingly okayed a bill in less than 30 seconds that allowed indiscriminate hunting of cougars in the state of Utah, and nobody mentioned it to anybody. And it is the way our system is set up, and this is one of the benefits of a professional legislature. The clock isn't ticking. This is why Congress takes years to review and pass any kind of bill. Comparatively in the state of Utah, we pass bills in hours or days. So we need to spend more time on bills, yes. I'm not sure that absent a change in a belief in how we conduct ourselves, that just changing the amount of days we have would actually solve it. I think it's less about the amount of days that we are at work and more about the mindset of what we ourselves need to put into knowing what these bills are.
Me? Hi, my name's Mark. Going all the way to the top, and this is important because what you have to deal with is the environment, the political environment. Who do you think is writing the scripts for the Republicans on issues? I'm thinking it's the Koch network of billionaires, as outlined in the Dark Money book, and that percolates down through Fox News and everything. And at the local level, what can Democrats and liberals do better as a brand so that we are accepted? And finally, how do you deal with the voter that says, hey, I'd vote for Hitler if he said he was against abortion?
I wish I could say that those voters weren't out there, but they are. That was a really, really loaded question. How much do we have? Another hour? I get frustrated with this idea that if we as Democrats and liberals just tell people what we're working on, they'll come around, because a lot of times they don't. There are, the political parties are really, really entrenched in the way people vote. I have walked many districts that are not my own, where I had people slamming the door in my face simply because the placard that I was holding had a D behind the name.
That never used to happen.
Yeah.
Door in your face.
Right. Well, and that's not my experience, so I must have been walking since that started. I guess I didn't knock a lot of doors before that. But it never, my sense is that prior to the last 10 to 15 years, people skewed one way or another politically, but at the end of the day, they really wanted to know what people believed. And there was also a sense that it wasn't the end of the world if you were represented by somebody from the opposite party. And both sides are guilty of this. I mean, I spend no small amount of time distressing over my representation in Congress, although I will say that I'm really glad I'm not represented by Chris Stewart anymore. At least Blake Moore takes my phone calls. But that doesn't mean that he's necessarily going to vote how I ask him to vote. And I think at the end of the day, I hope that people will see legislators voting that support them and their families right down to the kitchen table. And there are legislators like Ashley Matthews, who represents the big part of Kearns, who flipped a seat when she ran 4 years ago. And she got more Republicans than Democrats to vote for her. Suzanne Harrison in Sandy, when she won because she got most of the Republicans to vote for her, not because there was this groundswell of Democrats that nobody knew about. And so I know that it's possible, the right candidate at the right time can sway those votes and have those conversations. The problem is it always has to be this perfect storm of the perfect candidate with the right amount of time and the right resources, and too often it's just not. But at the same time, I've got some moderate Republican colleagues whose work and voice I really value. Representative Steve Elison runs amazing bills getting funding and services to people in mental health crisis, and so I don't know that it's in the short run we're going to successfully have a conversation that it has to be Democrats versus Republicans. What I'd really, really like to see is the moderate voices that actually exist in the districts have representation that reflect that moderate voice, because you have, Layton demographically is very moderate, but they've got a really, really far-right extreme representative because of the caucus convention system, because the incumbent chose not to get signatures. And I can't tell you, and sitting on government operations, it's been really interesting to see how hard in the wake of SB 54, which was the signature gathering compromise, what year was it, 2016? I don't know. Anyway, it's been a while. But, it has, Ray Ward, who represents Bountiful, is a classic example. He loses at convention every term and then wins by a huge margin in his primaries when it goes to the ballot. And so it's been interesting to see the number of bills that are being run to try to water down or eliminate altogether the signature gathering process. Because right now, my view is that it's the only way to keep moderate voices that are really reflective of the districts in the legislature. And right now, we're in a phase where the extremes are counterbalancing the moderates, and I hope that it swings back. But for now, until so in the presidential elections, state of Utah typically has between 33 and 38% of voters vote for the Democratic candidate, but 18% of our legislature is a Democrat. So
swing one way or another toward Democrats or away?
Right now, I feel like I'm hoping we're at the tail end of a swing to the right, and that we'll be coming back to moderation, and that some of these swing districts will have either a Democrat or a moderate Republican instead of some far-right Republicans. And I promised myself I wasn't going to get hyper-partisan in this talk, but there you go. Sorry.
Bernie Hart, thank you for being here, Jen. I'm here with Mohammed, and who's been a big supporter of our program, and my wife, Marita. And the reason they're standing with me is they're both members of the PAMI Council here in Salt Lake City in Utah, which is a group that advocates for people with mental health issues. And we're going to be starting a campaign shortly, if the three of us have any say, that's going to start looking at the effectiveness of different programs that work with the homeless and the mentally ill in Salt Lake City. It is my personal belief that not many of the programs are working, and many of the programs that are being funded by the legislature and the city council just aren't helping people, other than the few people that Jen mentioned, that they can, isolated cases, they help individuals, but there is actually absolutely no proof, none, that it is the programs itself that help people, and that the results and the successes weren't the result of individual initiative. I've been encouraged this morning by somebody here to ask harder questions and to ask more questions and to keep being persistent and demanding data in support of any program or any funding that goes to addressing the needs of mental health, people dealing with mental health and homelessness. So, will you wait 1 second? I do have a question, but let me I have to put some stuff out there first. The problem is, I've asked these questions of a number of elected officials that vote and fund programs, and they have absolutely no information about how well the programs work. None. I have been put on banned from, my emails are banned from the city council because I ask them for information about the success of outreach programs and their policing programs, and there is none. I know there isn't. They'd shut me up just by giving me the information. So the question is, if we started a little effort in support of the PAMI Council here in the church, and I've already got interest from a couple of people, how would we interest legislators in looking and working with us to find data-driven solutions to problems rather than the process we have in place now? Who would you think might be willing to work with us?
Thank you, Bernie. So one of my biggest frustrations actually with the legislature is that when we bring a difficult problem to legislators and we say, I have an idea, I want to run this bill to try to find a solution to X problem, the legislature says, oh, I don't think that's going to work, let's study it. And we study a lot of things, and we don't actually sometimes we get a few reports, and it's not always really good data. I would prefer, if you've got a program that you can come to me and say, these are the outcomes, this is the hard data, then I can take that data and say, maybe we as a state need to support this program by being a co-funder along with private entities, along with grant-making authority, to find the solution. Because, like I said during my talk, how do we find good data to drive good policy? And I've been saying this since day one. Good data drives good policy. Sometimes, when the data says what people want to hear. Sometimes it's anecdotal data that they conflate to being a truth, and we pass legislation. I am never going to stand up here or anywhere and say the legislature gets it right. I think we get it wrong more than we get it right. I think that we spend a lot of time fixing things that we get wrong. I wish the system worked better. But, and I have said this to you before, Bernie, if you give me good data, I will use it. But I would also I would push back and say that to your assertion that there is no data that the programs that we're using has worked. I believe that it has.
We have time for one more question, I believe. Go ahead, Tristan.
One last question from Zoom. Renee Douglas writes, thank you for the presentation, Jen. Can you expound more on your comment that medicine is not a business? I would like to better understand that perspective.
Sure, thank you. So my belief is that, especially when it comes to healthcare access and the cost of healthcare, that assuming that it can be run like a business, like selling widgets, that it's all up to supply and demand, is the way to solve access to healthcare and to improve health, especially when we're talking about really expensive chronic diseases or even more expensive acute injuries or something like cancer. I don't think that you can say this is best served by market forces, that it's supply and demand, because market forces, supply and demand, is dependent on somebody being able to say, I want to use my finite resources for XYZ, but if I can't afford it, I'm not going to die. I don't think that healthcare is something that responds to market forces. It's not a widget. It's not, a new pair of shoes or a nicer car that, if absent having, it could lead to, more expensive, worse health outcomes that diminish your ability to live and thrive, to work, to make money, to support your family. And so saying that we can run healthcare like a business, that it is responsive to supply and demand forces, is just a very faulty way of thinking.
Thank you, Jen, so very much. Thank you. If you had questions that you would like to pose that didn't get answered, here's Jen's contact information. Feel free to contact her. I'm going to be asking her about if there's any data that she can present to her colleagues that shows that our cheapness in the state in funding healthcare actually has worse outcomes compared to states with comparable populations and adjusted for age. And she can answer for that offline. But again, we'll thank Tristan up in the booth, our ushers, our coffee team. Please join us. And especially, let's give Jen one more thank you.